In this video, we'll do an exam review on chronic granulomatous disease. Few important exam questions before we start the top. Question number 1. Which cells are affected in chronic granulomatous disease and why? Number 2. How catalase in catalase-positive bacteria decrease hydrogen peroxide production. Number 3. Why granulomas occur in CGD. Number 4. What's a giant cell? And number 5. What's a TRAPS syndrome? Now, chronic granulomatous disease. Chronic granulomatous disease is a X-linked recessive disease that causes immune malfunction. There is defect of granulocytes and monocyte macrophages, oxidative metabolism. And why does it occur? There is deficiency of NADPH oxidase in the granulocytes like neutrophils and monocyte macrophage, causing defective oxidative metabolism leading to failure to generate superoxide anions and other oxygen radicals. NADPH oxidase converts molecular oxygen to the superoxide oxygen radical. So what does superoxide oxygen radical do? It releases energy that is called respiratory or oxidative burst. In CGD, there is decreased oxygen production with decreased oxygen radical formation, so absent respiratory burst. So this enzyme NADPH oxidase, what does it do? It oxidizes NADPH and reduces molecular oxygen to produce superoxide anions. Superoxide is then converted to peroxide. So NADPH converted to NADP under the action of NADPH oxidase, causing oxidation of the NADPH and forming hydrogen peroxide. So in CGD, hydrogen peroxide production is decreased. Why? Because there is no oxygen. So NADPH oxidase does not convert molecular oxygen to the radicular oxygen radical. So the production of H2O2 is decreased. So what happens normally is that hydrogen peroxide and chloride, they combine in the presence of myeloperoxidase enzyme to form HOCl, hypochlorous acid, which is a bleach, and then it is converted to the free radical of the HOCl, and this HOCl kills the bacteria. So the deficiency of the NADPH oxidase results in a recurrent infection with Catalase-positive bacteria like Staph aureus and the fungi like Aspergillus. So why does Catalase-positive bacteria Staph aureus cause a recurrent infection? Because catalase in the Staph aureus, it decreases H2O2 production, and H2O2 then combines with chloride to form HOCl to kill the bacteria. So how catalase in catalase-positive bacteria decreases H2O2? Catalase destroys hydrogen peroxide. Catalase converts H2O2 into water and oxygen. So HOCl is not formed, which is required to kill the bacteria. The other enzyme in the Staph aureus, Coagulase, causes coagulation, and that forms a fibrin around the bacterial product to protect it from the phagocytosis. So these are the two enzymes. Catalase destroys the H2O2 to form H2O and oxygen. So HOCl is not formed. That kills the bacteria. And number 2, the other enzyme in the Staph aureus, Coagulase, that causes coagulation, forms a fibrin around the bacteria and protects it from the phagocytosis. That is why the staphylococci are not killed in the chronic granulomatous disease, because of the function of catalase that converts H2O2 to H2O and water. But catalase negative organisms like a strep are ingested and killed because they produce HOCl, hypochlorous acid. So the normal function of H2O2 and chloride to form HOCl is abolished in the chronic granulomatous disease. Now, clinical features of the CGD. There is suppuration of the lymph node, not responding to antibiotic. Number 2, skin involvement. There is skin lesions, the aphthous ulcers, and chronic inflammation of the nares. Number 3, lungs are the most frequent area of infection, and pneumonia is common. And a type of fungal pneumonia in CGD is called mulch pneumonia. And what happens in the intestine? It causes a form of irritable bowel disease that leads to stomach pain, diarrhea, bloody stool, nausea, vomiting, and abscess formation. And number 5, granulomas are common in gastrointestinal and genitourinary tract. So why Why granulomas occur in chronic granulomatous disease? In chronic granulomatous disease, there is impaired killing of the intracellular organisms because of defective macrophage function leading to granuloma formation. So what's the normal function of macrophage? Normally macrophage, also known as big eaters, are abundant in the capillary walls of the lung, GIT, lymph node, spleen, liver, bone marrow, where they remove microorganisms by producing enzymes, lysosomes, protease, hydrolase, and cytokines, TNF-alpha, interleukin 1, 8, 12, and 18, and by producing components of the complement. The normal function of the macrophage is that they help replication of lymphocyte, killing of the tumor viruses. They form to fuse giant cells to eliminate intracellular organisms, for example leishmania, and patients with Chilaiditi syndrome and chronic granulomatous disease have defects in mononuclear phagocyte system, genetic defects in TNF-gamma, tumor necrosis factor gamma, and interleukin cause impaired killing of intracellular bacteria like mycobacteria, killing of intracellular bacteria, salmonella, and certain viruses. Now, what's TRAPS syndrome? TRAPS means TNF-alpha receptor associated periodic syndrome. So what happens in TRAPS syndrome? TNF-alpha receptor is pyrogenic, and a mutation and then stimulation in TNF-alpha receptor causes prolonged and recurrent episodes of fever in the absence of infection in TRAPS syndrome. Erythematous rash and arthralgia are also common in TRAPS syndrome. TNF-alpha and interleukin-1 are important in causing gram-negative shock, and TNF-alpha and toxic oxygen increases hydrogen peroxide production. Blockade in TNF-alpha by antagonists like infliximab and etanercept causes severe infection with mycobacteria and fungi. Now, what's a giant cell? Macrophages used to form multinucleated giant cells to eliminate intracellular organisms, for example leishmania. Number 1, Langhans type of giant cell, which have multiple nuclei. These cells share the same cytoplasm and the nuclei are at the periphery of the cell. The Langhans types of giant cells are found in primary focus in tuberculosis, which is known as tubercle, and they are also found in syphilis, leprosy, and sarcoidosis, and in fungal infection. Second type of the giant cell is foreign body giant cell. In this form of giant cell, the nuclei are scattered throughout, whereas the nuclei in Langhans type of giant cells are scattered at the periphery. These cells are found in prosthetic devices and biochemical material area in the tissue and in giant cell tumors of the bone. The complication of the CGD are immune thrombocytopenic purpura and juvenile rheumatoid arthritis. Now, answers to the question. Question 1. Which cells are affected in chronic granulomatous disease and why? The defects of granulocyte and monocyte macrophage oxidative metabolism. The deficiency of NADPH oxidase in the neutrophils and monocyte macrophages causes defective oxidative metabolism. Question 2. How catalase in catalase-positive bacteria decreases hydrogen peroxide production? Catalase converts hydrogen peroxide to water and oxygen, so it destroys hydrogen peroxide, whereas coagulase in step causes coagulation and forms fibrin around the bacteria, protecting it from phagocytosis. So Staph aureus are not killed in chronic granulomatous diseases. Question number 3. Why granulomas occur in chronic granulomatous disease? There is impaired killing of the intracellular organism because of defective macrophage function leading to granuloma formation. Normally macrophages, which are big eaters, are abundant in the capillary walls of the lungs, GI, lymph node, spleen, liver, and bone marrow, where they remove the microorganism by producing lysosome, protease, hydrolase, and like cytokines like TNF-alpha, interleukin 1, 8, 12, and 18. Question 4. What's a giant cell? We already did it. Macrophage form to form multinucleated giant cell. Two types, Langhans and foreign body type. Langhans type have nuclei at the periphery of the cell, whereas the foreign body giant cell have nuclei scattered throughout the cell. Now, what's a TRAPS syndrome? TRAPS syndrome means TNF-alpha receptor associated periodic syndrome.